Next up, we have the distinct pleasure to introduce one of the leading engineers in integrating various health IT systems and health systems, health information systems and platforms across life sciences and certainly hospital systems and managed care systems. Armand Morrison from Persistent Systems, one of the leading IT solutions organizations in the world. And Armand was at ViVE and at HIMSS, and we're looking forward to hearing a little bit more from Armand about what he learned and what some of the big trends were that he saw at both of those meetings. Armand, how are you today?
I'm great, Stan. How are you?
Not too bad. Again, thank you for joining us. We know how busy you are, and let's just dive into it. You know, from your perspective and from what you saw, what were some of the major learnings that you picked up from ViVE and HIMSS this past month?
Sure, absolutely. So just to give a little additional background for some of the folks that are out there. So Persistent Systems is probably one of the largest digital engineering firms that no one's ever heard of. We're about $800 million in revenue, and healthcare and life sciences represents about 40% of that revenue. And my role at Persistent is really leading the strategy and client engagement with a primary focus on the provider market, which includes academic medical centers and large health systems. So from that perspective, and I'm also active with HIMSS. I'm on the board of directors of the New York State chapter of HIMSS, so very, very involved in that. And I've been associated with Chime, which partnered with the HLTH organization this past year to create the first ViVE conference. So there's lots of background there that I thought would be valuable for the audience here. But some of the things that I saw at both conferences, some similarities were a lot of activity and interest and promotion around the patient experience opportunity, kind of reducing friction points, making the consumer experience in healthcare as streamlined as possible, kind of similar to ordering food on Grubhub as an example. And another area of significant interest in both conferences was around cloud strategies. Everyone's moving to the cloud, whether it's full EHR systems or more of a disaster recovery to start with, and then moving into cloud. So those were two big areas that I saw a lot of focus and a lot of attention in both the ViVE conference as well as HIMSS.
I think certainly we know a lot about the cloud. We've heard a lot about that movement toward the cloud. That's great to see, and it's great to hear. Tell us a little bit more about the cloud and maybe how you've seen the ecosystem moving to the cloud and what kind of applications they've been moving to the cloud, like maybe digital front door stuff or something like that for hospital systems and for clinics.
Sure, that's a great question. Thanks for that. So kind of actually coincidentally aligning with the go-to-market strategy here at Persistent, we've really identified 4 pillars, all which involve cloud to some degree. And those pillars are doubling down on our digital front door strategy, which for us, digital front door, we know means so many different things to different people. Digital front door for us is not a product or a solution. It's a combination of components and elements really knitted together to help health systems improve patient acquisition, engagement, patient experience, as I mentioned earlier, reducing and eliminating some of those friction points that create incredible dissatisfaction and frustration on the part of patients, patient's family, all lumped together in that whole consumerism of healthcare. And cloud is a huge component from a digital front door strategy. And from Persistent's perspective, because we see so much traction and energy around cloud, again, whether it be an organization that wants to move their entire EHR to the cloud, or if they want to identify certain applications, or maybe they want to start with a data platform that's cloud-based to improve access, capability, reduce reliance on on-prem hardware, and downloading and extracting of data that then becomes static, and people sitting around a board meeting and presenting data that means different things to different people. There's all kinds of stories out there about that. But Persistent has made some significant investments in 2 cloud companies. We've acquired a Microsoft Azure specialty partner called Data Glove, and we just announced an acquisition of Media Agility, which is a Google Cloud Premier partner. So really, we're putting our money where our mouth is by making some very significant investments in to support our cloud strategy that ultimately benefits our clients. And as I mentioned, from a digital transformation perspective, which unfortunately has become quite a buzzword, for us at Persistent, digital transformation is truly cloud-driven and cloud-based. And we leverage our trusted industry experience on a solution set that we call Data Foundry, and building that transformation to focus on our premier partnership with Salesforce as one of the key platforms that we work with, as well as other no-code and low-code platforms, as well as enterprise automation to improve operations, improve efficiencies, and reduce clinician burnout. All of those capabilities, all of that functionality, all of those solutions, if you will, are all heavily cloud-based and cloud-driven.
It's fantastic. By the way, just reading the chat box, Jim says to say hi to Helen for him. And Jim St. Clair, he also says that it's great to be back in in-person meetings. Jim, can't agree with you more. Having been at both ViVE and HIMSS, can't tell you how good it was to see a lot of folks hadn't seen in about 3 years or so. So that was really special. Just deepening that conversation again. I think the questions around this are in the chat box are are fast and furious here. I think folks are really interested in understanding the digital front door and what kind of value that's brought in. So love to hear a lot more about that. But I want to ask you about a few more things. When you are looking at certainly patient experience and the EHR, we're seeing with virtual health growing and then contracting a little bit, but still a permanent part of the US healthcare ecosystem because of the reimbursement pathways that have been built during the pandemic for telemedicine and remote patient monitoring and virtual care. What are some of the EHR topics that you heard people discussing, or some of the functionalities that you and your teams at Persistent are building that you saw at both conferences that are really tied deeply into the cloud experience? Sure.
So I think you hit the nail on the head. A big component of that is telehealth, which always can be a component of digital front door. We take the approach of really looking at opportunities to improve the process around patient acquisition, patient access, and treating those patients where they are, which is not always at a physical location. So remote patient monitoring, telehealth, telemedicine applications, huge opportunities that rely specifically on the cloud in order to accomplish that. The ability for collaboration around care that, again, it's boundless, right? And boundaryless. Clinicians and specialists no longer have to be physically in a room in order to help care for a challenging situation. So there's a lot of avenues and aspects from the whole telehealth perspective as it relates to patient care, but again, all relying on the cloud. And we're starting to hear so much more, as I mentioned a couple times, of organizations looking to move their entire enterprise to the cloud. Healthcare is way behind the curve in terms of technology adoption. And we've heard things like, well, we're healthcare, we're different. We're not a manufacturing organization, we're not banking, we're not finance. But at the same time, technology can help health systems do more with the increasingly large amount of less that we have to deal with. We've all heard about the Great Resignation, and that's affected healthcare more than I think most industries because of the situation with the pandemic. So organizations continue to struggle with ensuring that they have the right number, the right type, the right quality of resources in order for them to do what they need to do and run their business. Certainly the opportunity for engaging with system integrator partners like Persistent can certainly support that and help with that strategy as well.
Yeah, and then we've got a couple minutes left here, but would love to hear about a lot of what I was talking to folks at ViVE and HIMSS about around the Great Resignation, and this kind of societal trend that we're seeing of, especially in healthcare, in hospitals and clinics, of everyone from physicians to nurses to ancillary clinicians to staff just leaving healthcare in droves. And talk a little bit about that. I know Persistent's a global organization. You've got tens of thousands of staff all over the world. Talk a little bit about how you've been able to help a lot of your partners who all of a sudden are short-staffed, and how Persistent as a group that has this kind of agile project management and staffing system comes in to save the day kind of thing.
Sure, absolutely. So as you mentioned, leveraging our enterprise of over 15,000 employees and experts to be able to help organizations with not necessarily staff aug or staffing needs, but supplementing their staff with an agile development, deploying Scrum teams as appropriate. We are a global organization, so that whole concept around following the sun to help organizations get more done and get what they need done with supplemental staffing, whether it be a managed service, whether it be individual staffing requirements, whatever the case may be. Persistent absolutely is there for our clients.
That's fantastic. And again, really appreciate you joining us today. And again, Armand, I'm sure we'll see you at another conference soon. And for anyone who wants more information from Armand, we'll pop his LinkedIn into the chat box as well. But again, just tremendous work. Thanks, Armand.
Absolutely. Thanks, Dan. Great to be here.
Outstanding. And so again, we've got a lot of folks online. I'm looking at the attendees from all over the world, from India to the Middle East, Africa, Europe, Asia, Latin America, and certainly North America. And excited to have everyone joining us. Just to give you an idea where we are in the agenda, we've got a lot to still cover. We just talked about the cloud and virtual health. And then before that, Professor Tubia from Columbia Business School